Hoffman, go ahead.
Good afternoon, Chair Prusak, Vice Chairs Hayden and Salinas, members of the committee. It's a pleasure to be here today. My name is Ben Hoffman. I'm a pediatrician at Dornbecker Children's Hospital, a professor of pediatrics at OHSU, and the medical director of the Tom Sargent Safety Center there. I'm a nationally recognized expert in child injury prevention, and I currently serve as the chair of the American Academy of Pediatrics Council on Injury, Violence, and Poison Prevention. Many of you may be familiar with the Vista Bridge in Portland, which sits 120 feet above Jefferson Street and the Max Line. Between 2004 and 2013, 13 people committed suicide by jumping off that bridge. After 3 deaths occurred in the first 6 months of 2013, 9-foot fences were installed. They have been remarkably effective. Not a single person has died jumping off the Vista Bridge since. We all know we're in the midst of a historic public health crisis and our lives have all been upended. However, we have to remember that while we're dealing with this new threat to our health and well-being, the old threats have not gone away, and in many cases have actually become worse than before. One of those epidemics is that of firearm injury to kids and teens. As a pediatrician, I remain haunted by the deaths of kids lost because they had access to a firearm at exactly the wrong time. A patient of mine who several years ago took his life with an unlocked firearm found in his home. In a moment of impulse when he was alone, he left a suicide note, got the gun, shot himself in the head. He was 11 years old. A 3-year-old boy who found a loaded handgun in his parents' bedside table. And doing what any curious 3-year-old would do, he explored it until it fired, sending a bullet into his face. I was part of the pediatric trauma team in the emergency department who worked feverishly to try and save his life, but his injuries were too great. As the pediatrician, it was my job to tell his parents. Can you imagine what it is like sitting in a room, staring a mother and a father in the eye and informing them that their baby was dead, the result of a firearm they had kept at their bedside? In the United States, as Director Banks noted, around 2/3 of all firearm deaths are suicide, and half of all suicides are by firearm. Suicide problem is a gun problem. Firearms are by far the most lethal form of suicidality. Around 90% of suicide attempts with a gun end in death. And I want to contrast that with the fact that fewer than 5% of people who attempt suicide with any other method will die. And suicide is not inevitable. Of people who survive a suicide attempt, approximately 90% will go on and not die from suicide. Simply put, a reduction in suicide attempts with firearms will result in an overall decline in the suicide rate. Talking about kids, we've seen a massive increase in the rate of suicide in kids 18 and younger, around 56% in the last 10 years or so. And it is now the second leading cause of death for youth 10 to 19, trailing only motor vehicle crashes. Over 1/3 of 10 to 14-year-olds who commit suicide use a gun, and almost half of 15 to 19-year-olds do. Most of the time, it's a handgun. In our own great state, between 1999 and 2019, which is the last year we have data, our overall youth suicide rate is 26% higher than the national rate, and our teen firearm suicide rate is even worse. On average, 17 kids kill themselves with a firearm each year, and that puts us at a rate 59% higher than the rest of the country. Firearm suicides among kids and teens are often a result of an acute situational factor, a crisis in their life, and behavioral health remains a huge factor. There is much we can and much we must do. I also need to point out that this is an issue of equity. American Indian, Alaska Native children and teens have a firearm suicide rate almost twice as high as all other racial and ethnic groups combined. The common denominator in suicides for kids and adults remain the acute impulsivity of the action. In a moment of crisis, means matter. Access to lethal means like a gun increases that risk massively. As in most areas of injury prevention, there is never one simple solution. The issues are complex, multifactorial, and we need solutions that include layers of protection. As Director Banks noted, there's a lot that we have to do and will continue to do around the behavioral health system for kids, around building resilient communities, addressing additional risk factors and systemic inequities. The method used in a moment of crisis can mean the difference between life and death, and access to a gun is often that difference. Delaying access is the key. We need to act to ensure that kids and teens at risk for suicide can't get their hands on a gun. Means matter, minutes matter, safe storage of firearms matter. I want to end by mentioning that I'm not going to have time to go into issues of unintentional injury. This is when a child shoots another child. That happens not infrequently, although the numbers are dwarfed significantly by those of suicide. One thing that I know that has been a concern previously is the constitutionality of similar laws that prevent access to children to firearms. We know that storing firearms as has been recommended by the American Academy of Pediatrics, locked, unloaded, with the ammunition stored and locked separately, can decrease the risk of unintentional death to kids by about 85%, and death across the board by firearm to kids and teens by about 54%. 29 states in the District of Columbia have already passed these laws. And despite contention from opponents, these laws are constitutional. The Ninth Circuit Court of Appeals differentiated these laws from the District of Columbia versus Heller, because these laws do not prohibit somebody from carrying a loaded handgun while in their home, and also held that safely stored guns can be obtained or enabled within a matter of seconds, which we know to be true as well. Numerous studies over the past 20 years have found that child access prevention laws can reduce suicide and unintentional gun deaths, with the greatest reductions occurring in states that require safe storage of firearms. I have a colleague who has stated that pediatricians are the ultimate witnesses to failed social policy. I assure you, this is my life. I have seen too many children and teens die from preventable causes, including unintentional and self-inflicted gun injuries. I am here today to give voice to the kids whom we did not protect and whom we now are not protecting. There is no universe in which an impulsive child or teen should have unintended access to a gun. This is neither pro-gun or anti-gun, but it is firmly, proudly, and steadfastly for science, for common sense, and for children and youth. We cannot gun-proof kids. We have to child-proof guns. Thank you very much for this opportunity. I'd be delighted to take questions.
Thank you, Dr. Hoffman, for your work and